Injectable fillers help to restore volume to the face and to reduce the appearance of facial wrinkles. Injectable fillers are one of the most popular facial rejuvenation techniques available today. As we age, we naturally lose the fat in our faces that creates volume. This leads to sagging skin and the formation of wrinkles. Additionally, the innermost layer of skin, known as the dermis, is composed primarily of connective tissue that provides the skin with a support network made of collagen and elastin fibers. Over time, these collagen and elastin fibers break down, resulting in a loss of skin elasticity and the formation of facial wrinkles. Hyaluronic acid is a natural molecule that is found in the connective tissue of the body. Hyaluronic acid binds to and absorbs water molecules, and when used as an injectable filler, hyaluronic acid restores volume to the face, improves facial contours and some facial scars, softens the appearance of wrinkles and folds, and enhances the volume of the lips. One of the fastest-growing dermal filler treatments available, hyaluronic acid injections work by replacing the hyaluronic acid in the face that has diminished over time, restoring the volume beneath the skin's surface. There are many different types of hyaluronic acid filler products available. Your provider will help you determine which product is most appropriate for your treatment goals. Your hyaluronic acid treatment will begin with a consultation, during which your provider will examine your face, discuss your treatment goals and any medical conditions or current medications that you may be taking. Determine the best type of hyaluronic acid product for your treatment and address any concerns that you may have. Depending upon the extent of your treatment, hyaluronic acid injection procedures typically last from a few minutes to up to an hour. The injection sites will be cleaned and a topical anesthetic or injection of local anesthesia may be used to numb the treatment area prior to the procedure. Your provider will then inject a precise amount of hyaluronic acid beneath the skin. Massage the treatment area and evaluate the results. Additional filler will be injected if needed. Common areas that are treated with hyaluronic acid include under eye hollows, vertical lip lines, thinning lips, hollow cheeks, nasolabial folds, and marionette lines. It is uncommon to experience serious complications from hyaluronic acid fillers. Potential risks may include infection, skin damage and scarring, itchiness and rash, and asymmetry. You may experience some minor redness, stinging, swelling, or bruising in the treatment area during or after your procedure, but this is temporary and should subside in the next few days. Most patients are able to resume normal activities immediately following treatment, but you may be advised to refrain from strenuous activity for 24 to 48 hours following your procedure. You should notice results immediately following hyaluronic acid injections. Some patients may need more than one treatment to achieve their desired results. The length of time that the results of hyaluronic acid fillers will last is dependent upon the individual patient, the type of product used, and the areas treated. Typically, hyaluronic acid fillers last from 6 to 18 months.